Hi everyone, welcome back to DOC2US podcast. In today's episode, we're going to discuss if it is safe for breastfeeding women to take medications. Pregnancy is a huge deal, and so does caring for the little one after giving birth. It is common for breastfeeding mothers to feel anxious about the food and medications they take. This podcast aims to give a simplified overview on medications for breastfeeding mothers. We hope that this can ease the anxiety of many breastfeeding mothers out there, and do not give up breastfeeding unless your doctor says so. There are so many medications out there, so which ones are suitable for breastfeeding mothers and which ones are not? The simplest and fastest way to find out is by simply consulting a healthcare professional. A general rule of thumb is as follows. Always avoid medication therapy when possible. However, this does not mean that if you're breastfeeding, you should abstain from any medications even if you're in great discomfort. Consult a healthcare professional and they will recommend the best solution to you. So, what about medications that can be prescribed directly to a baby? These medications are usually safe because the doses transferred via breast milk are much lower than the doses taken by a breastfeeding mother. What about insulin and heparin? These medications are normally not taken by mouth due to poor oral absorption. These medications are administered via injections and they are generally safe for breastfed babies. So, if you are breastfeeding and you are taking these medications, it should not be a problem for you. Another good news, inhalation medications such as inhalers for asthma are also considered safe for breastfed babies. Medications that are highly protein-bound, have low lipid solubility, short half-life, or have large molecular weights do not seem to enter breast milk. But of course, this is a technical matter and it is something that you should consult a pharmacist about. The risk of medication toxicity is higher in preterm and ill babies, and it is rare in babies over 6 months of age. Due to ethical concerns, many medications are not well studied among pregnant and breastfeeding women. Therefore, many medications are discouraged among breastfeeding women, but not because they were proven to be dangerous to mother and baby, but simply because we do not have enough evidence or data to know if they are actually safe to be used or not. However, your healthcare professional would always choose medications that are well studied in babies. Here comes the question, what if as a breastfeeding woman, you really have to take the medications? Do not worry, here are some of the ways your healthcare provider may advise you to do. First, your healthcare professional may advise you to use topical therapy if possible. Topical therapy are used on our skin and it has a lesser absorption of medications into the body system. Therefore, they do not enter into breast milk significantly. If your medication requires once daily dosing, take the medications just before the longest sleep interval for the baby. And this is usually after the bedtime feeding. This is so that by the breastfeeding time, your body has already metabolized most of the medications, therefore minimizing the amount in breast milk. However, if you need to take your medications more than once a day, breastfeed your baby immediately before your medication time. Your healthcare professional is the best source of information when it comes to breastfeeding do's and don'ts. Consult them whenever you have doubts. It has come to the end for this week's episode. If you have any health-related questions, you can consult our healthcare professionals on DOC2US. You can also download DOC2US app on Apple App Store, Google Play Store, and Huawei App Gallery. Take care and we'll talk to you in the next episode. Bye!